Thank you all. It's a pleasure to be here today. We're here to talk about a very important topic, but what that really boils down to is taking some of the critical technological advancements, issues, challenges that you're going to be discussing today, and putting them under the lens of reporters so that they understand and, quite frankly, report reliably and accurately on what's being done. The way background, we are from Fin Partners. We are a global public relations agency with offices around the globe. One of our specialties is health. And not only do we have the pleasure of working with some of the leading names in digital health, but we also work with a variety of drug developers, med tech manufacturers, patient advocacy groups, professional organizations, you name it. By way of a brief introduction, Laura and I are senior members of the Fin Health Media team. And what that means is we have decades of experience in not only developing communication strategy and working with C-level executives on messaging and coaching, but also rolling our sleeves up, our proverbial sleeves up, and working with some of the nation's best agenda-setting reporters on how they write stories on healthcare. So again, it's so good to be with you today. So let's start with the most important question. Why are media relations important to IT companies? Why should it be a critical part of your strategy? Now, there are several interrelated reasons you can see. Everything from building trust with your target audiences, whether they're healthcare providers, patients, the street, other researchers, or accelerating growth and awareness of what you're doing, distinguishing you from your competitors, making sure that you have your own piece of the pie, so to speak. But it's also about including your narrative in healthcare reporting, how you are a part of positive change, not just somebody who's joining a long line of other companies, and how your people, the people around your tables, are more than executives, they're thought leaders. They're thought leaders with their own perspectives, and they, quite frankly, they have their finger on the pulse of what's going on in the industry and are willing to share it with employees.
Glenn, I love this slide because it talks about why health is important, why media relations help elevate what our folks in the audience might be thinking about with their organizations. And I wonder if we could take it one step further and talk about the role that the media strategy helps in having health organizations be able to shape their public perception.
I mean, in essence, and we've said it a million times, I know myself, harnessing the media to communicate is no longer a nice to have. It's no longer something that should be considered something down the line. I mean, we consider it must have in remaining competitive and relevant in all the noise that's going on about digital health today.
Yes. So as Glenn had a great introduction about what we do, we are constantly working with journalists. That's what we do every day and what excites us the most. Here is just a snapshot of the media landscape, especially pertaining to the health IT trades that, as Glenn said, are shaping the agenda and making public relations and media reach amazing goals for health IT organizations. The rest of our presentation is actually going to be the results of a survey that we did with representatives from these publications, and we wanted to bring those insights to you. So we're really excited to unveil this today. Those insights talk about the biggest trends in health IT reporting, common public misconceptions, as well as ways and what influences what these reporters are writing about. If any of you have ever even opened a healthcare publication, right? I'm sure you all have. You probably want your companies in there to talk about the great things you're doing. And so we're going to show you a peek behind the veil on how to do just that.
Yeah, I mean, I'm sure there are varying levels of knowledge about working with media. But Laura, could you just tell everyone here how the media landscape in health and medtech have evolved in recent past?
I think that's a great level setting question because it's not like our jobs are not, hey reporter, here's a cool company, thanks, bye, right? It's so much more than that. There's strategy involved, there's thinking, but also it's remembering that journalists are people doing a job just like we are all career people doing jobs in here. And I think when we think about the media landscape, it's so important to realize that, digital has helped in so many ways expand access to different articles and stories, but it's also created a demand for more articles and more real time, right? If you're not waiting till the next morning's issue, you want to get that story out now. At the same time, reporters and newsrooms are shrinking. Reporters are going freelance to have more opportunities for jobs. So when you think about that reverse dynamic, public relations professionals can come in and really be that conduit to give the reporters the exact formula they need to make their jobs easier and then ultimately to get the stories written that we want to get written.
Absolutely. So our first question to our reporter survey respondents, I think it's paramount to understanding of what's going on in these newsrooms. And the question is, what would you consider the biggest news topics in health, IT, and digital health? In other words, what can we expect the media to be concentrating on in reporting on those spaces? No surprise to anybody in this room, AI, artificial intelligence, is number one at 53%. Some other important topics that we have identified, cybersecurity challenges and data privacy. You heard somebody discussing that before. Integration of wearable technology. How do you get people with chronic diseases to be wearing these? And trust these wearable technologies. And of course, implementation of electronic health records. That's an important one as well. While I don't think these are necessarily surprising to anyone in the room, I think what's important about it is that this is a snapshot of what the reporters who are influencing digital health are going to be concentrating on in the near future. We know that these are the topics that these reporters are going to be putting under their microscopes, and the goal should be helping them reporting on, making sure that they have accurate information, and also to make your leaders, your thought leaders available to help them do their jobs. I will say that, it's a slippery slope. Sometimes reporters enter the picture with an agenda. Sometimes they just want to hear you out and be educated. But either way, I think companies that accommodate the process are the trailblazers. And communication strategy is critically valuable.
I also want to share a disclaimer that these results were done way ahead of the schedule. So I love that we've been talking about AI today and the different facets of it, because I think what we are seeing and what the next slides will show you is that AI continues to be a topic that across the board, the health IT reporters want to know about. So just jumping into that second question of 2 of 5, so you know, we asked, what do these health IT reporters see as the next big topic they want to cover? And as I just alluded to, look at that yellow piece of that pie, it's AI. And I think that the increased use of AI, machine learning for personalized medicine and predictive analytics. So that's a mouthful. And I think all of these health reporters are trying to tackle that, to be on the forefront of reporting the companies that are making strides and, as Juan said, trailblazing in this area. And I love this slide because the rest of that pie is pretty split. And what that tells me based on the results is that there's a lot of definitions of health IT. Right? Health IT is this overarching umbrella, which could be things such as AR and VR, telemedicine, you name it. And I think when we think about working with these journalists, working with what they specifically want to cover, so again, we can get the right clients in front of the right ultimate audiences, their readers, it's about having an understanding on how health IT news tackles health IT versus maybe MedCity News's definition is a little different.
I mean, I mentioned the topics that are most interesting to reporters. And in the same vein, we also asked them what they consider to be the most misunderstood or construed issues under digital health or IT. And I think by knowing that, there's really another way into the process. Again, AI took top spot, particularly about replacing humans or actual medical professionals. I continue to read about it every day. I'm sure you do as well. But there's also misunderstandings about digital health and data privacy. With such major misunderstandings, there is another opportunity to work with the media, to let them know what they have right and what they don't quite have right, areas that they should be concentrating on, and experts that they ought to be speaking with to make sure that their reporting is right on. And I will say it again, those who participate in the process are more than just, another name. You are trailblazers in helping to make sure that the general public has accurate and reliable and realistic expectations about the technology and what it'll be used for.
All right, rounding out our survey. So we talked about what reporters are looking, what's on their radar for what they want to cover, and what they think they need to inform the public on. And now our last two questions talk about the ways that we can work with journalists. Again, we do this day in, day out, but it's so important for us to continue to just have relationships with these reporters and meet them where they are. I think, the insights from the survey and the insights that these reporters are gleaning for us show that reporting and journalism plays such a vital role, not just in reporting on the daily news, but also educating and clarifying information for their readers, their end users. Their work underscores why our work as public relations professionals, but also any of you that might be working with journalists to get your companies out there, must go beyond just generating buzz, which is a hot topic and definitely fun to do. But really making sure there's messages that clarify the information, that talk about the delivery and talk about transforming the healthcare industry at large.
Laura, one question that comes to mind is there's so many experts in the room. And I think the question is, how can healthcare leaders use the media to drive positive change and improve patient engagement? Really, in other words, how can experts help to make sure that the reporting is accurate?
I think that's so important. I think it comes down to the messaging that we talked about, right? Making sure that we are connecting with the right journalists at the right publications whose audiences are going to be the conduits that they want to reach. If you want to tell a patient story, the patient impact, one publication might be better suited based on their readership. I think also when you think about raising awareness of different products, but also different therapies for patients, right? New FDA approvals. In our work, we've also targeted clinical trial research or areas where the investigative sites are to be able to recruit. So there are so many ends to means that media can get you to, and it can also be investor partnerships or new partnerships that media can get you to. And I think when we think of all those goals, matching them with the reporters and what they want to cover is so important. So here, I'll just touch on 60% of our journalists surveyed said that they want to know about the breakthrough technologies that have the potential to transform the healthcare industry. Now, I'm not going to make people raise their hands, but I bet everyone here thinks that of their company, right? That's why you work for the company you do, because you are trying to transform healthcare delivery. So how can we be better at letting the journalists know about this so they can have all those goals I just talked about, meet all of those for your public relations needs? More than half of our journalists also said that insights from healthcare professionals and patients is important to their story reporting. We call that serving the silver platter, which is giving them all the tools they need to make their jobs easier, again, to tell that story. And it also threads that through that the human element is so important, because we can talk about how great products are all day, but if you have a patient saying, hey, being able to chat AI with my oncologist helped me notice something earlier, got me in the exam earlier, like that's incredible. And that illustrates it so much more than any press release could. I think the other two larger pieces of the pie are 40% of our survey journalists said regulatory and policy were really interesting as they consider what stories they're going to cover. And that just brings us to what a crazy world we're in right now in terms of regulatory policy. So thinking about plugging into current events.
Absolutely. And this is what I call where the rubber meets the road. This question. Do you see news coverage of health and digital health growing in the future? Yes, yes, yes. Everyone we spoke to agreed that it's only going to become more prolific, and it's also going to become more intense. You know, explanations of artificial intelligence and other technologies are going to be growing. We all should be expecting these in the future about all and every issue discussed today. I think some of the reporters we spoke to were good enough to share some additional feedback on why they think it's going to be growing. Obviously, due to rapid advancement and adoption of these technologies, it's going to be a part of your basic healthcare story. Therefore, they're going to be growing. And number two, because of the ongoing need to address inefficiencies and improving patient outcomes, that's also going to be what you do critical to these stories.
And Glenn, let's take it home. We really appreciate everyone's time today, but the last question I have for you is, we just talked about what reporters are looking for, that they're interested in learning about health IT companies and breakthrough technologies. So what are factors that our audience members should be considering when crafting their messages for journalists?
Absolutely. When you're speaking to reporters, don't just look at it from your perspective. Look at the overall story. Think of how people who don't have your expertise or who aren't as close to the material might perceive the story. And you cover it from beginning, middle, and end. Don't leave anything to gray. I think that's important. Be ready to provide details. We talked about clinical research today. Not only be prepared to cite it, but be able to provide it. Reporters are not going to take any expert on his or her work. They're going to want the evidence behind it. And if you're not able to do it, they're probably the process will wind us slow. So think about that before you do it. And number three, the necessity for validation. What is validation? Validation also means stories, anecdotes, proof from the people who are living, breathing, and eating these technologies. Patients, healthcare providers, and everything in between. Do tell stories and share them with detail and enthusiasm.
Well, we love enthusiasm and we love media. I hope you guys got that from us today. Thank you so much for your time. I know we're also in the session before lunch, so really appreciate your listening and participation. Also, a shout out to our journalists. Thank you so much for taking the survey, taking the time to do that. I'll say the full results will be on the Fin Partners blog tomorrow in case you do want to capture some of these insights of the charts. And Glenn and I will be around if you have any questions for us, but enjoy lunch. Thank you.
Thank you.